Cytecare Hospitals has a vision to redefine cancer care in our country. It is a patient-centric institution. We have sought to put the patient at the center and redesign every process that a hospital needs around the patient. Our primary focus is on clinical excellence in terms of bringing the very best medical talent from India and around the world into our hospitals. But most importantly, all this has to converge into a benefit and a superior outcome for our patients. While we try to provide the very best clinical care to our patient, the how, in terms of how that care is delivered to our patients, is equally important at Cytecare.
Dr. Poovamma, Senior Consultant and Director, Breast Oncology. Doctor, who is at risk of developing cancer?
Everybody is at the risk of developing cancer. The most often asked question is, why did I develop cancer? And the only answer I can give is just being a woman, and with age, as the age increases, you can develop breast cancer. In India, though, breast cancer is becoming very common in younger women too. So I would say all women above 40 should be aware about breast cancer, and just about anybody can develop it. Obesity, alcohol, other lifestyle risk factors like not having a child very late also increases risk for breast cancer. But some of these we can change, but some we cannot really change.
Does early detection mean better chance of a complete cure?
Early detection goes a long way in helping to cure breast cancers. For every cancer, we stage the cancer. How big is the tumor? When cancers are detected early, or stage 1 breast cancers have an excellent long-term outcome with cure rates of more than 95-96%, which drops down to less than 20% for stage 4 breast cancer. So we can see the huge difference in the long-term outcomes when the stage is early compared to a late stage breast cancer. So for breast cancers, we say mortality has come down in the Western world because most cancers are detected in stage 1, whereas in India, breast cancers are still detected in stage 3 and stage 4, because of which our mortality rates are very high. So please be aware about breast cancer.
Is recovery faster when detected earlier?
Obviously, recovery becomes quicker. The types of modalities of treatment required becomes fewer. For early breast cancers, we can do minimally invasive surgeries where organ is preserved. We don't have to, sacrifice the entire organ. Requirements of chemotherapy go down. The number of cycles of chemotherapy required can be cut down. For some types of breast cancers, we can completely forego chemotherapy for early stage breast cancer. So early detection obviously means improved outcomes, lesser modalities of treatment, faster recovery, and better long-term outcomes.
What are the most common signs for cancer?
Breast cancer can be a very silent killer. The most common complaint, I would say, or something the lady notices abnormal, would be just a small lump in the breast, or could be some kind of thickening in the breast, or maybe some nipple discharge, nipple retraction, or some change in the breast. Most often it's painless. A lot of women sometimes come into OPD, tell me they have had this lump in the breast sitting there from the past 1 year, and because it's been painless, they have not done anything about it. But then they might have lost a lot of time, and we could be detecting cancer in stage 3 or stage 4. So I would say any newly detected change in the breast in the form of a painless lump, thickening, change in the nipple position should be evaluated, and these could tell us that there could be a cancer lurking underneath.
How often should people go for screening?
For breast cancer, the recommendation is screening after the age of 40. At least once in every 2 years, we do a clinical breast examination with a X-ray mammogram and ultrasound. This screening helps us to pick up cancers way before the woman would have, identified a change in the breast or an abnormality in the breast. And with screening, we can pick up way more early breast cancer, stage 1 breast cancers. And like I said, early detected breast cancers have excellent long-term outcomes. For younger women, we say any new change in the breast abnormality has to be evaluated by your doctor so that a cancer can be ruled out.
What does typical screening involve?
So, for breast cancer, screening involves a clinical breast examination by the surgeon, followed by a mammogram, that is an X-ray mammogram, and an ultrasound of the breast. With these three modalities, we can pick up cancers and accurately diagnose them.
Dr. Raghavendra, Senior Consultant and Director, Department of Gastroenterology. Doctor, who is at risk and how does it help when people are aware for early detection?
So, talking about risk factors of cancer, everyone is at risk. Cancer is the second commonest cause of death worldwide. It is second only to cardiovascular diseases. But if you ask for some of the risk factors, age is one of those non-modifiable risk factor. As the age increases, chances of getting cancer increases. But there are a lot of modifiable risk factors, and the two most important are alcohol with smoking or use of any form of tobacco. These two constitute the commonest risk factors for most cancers that we can get. Apart from that, the modern lifestyle that we follow has its own negative effects. Some of it is due to the diet we consume, the diet which is rich in fatty fats, the diet which is rich in smoked meats and processed meats, and red meats is a risk factor for cancer. Obesity itself is a risk factor for many cancers, and there are certain infections like hepatitis B and C which increase the risk of liver cancers.
How does detection, early detection, how does it help in a better chance of a cure?
So early detection helps in not just curability of the cancer, but it helps in early recovery. So curability is not equivalent to complete recovery from cancer. It can be cured but not completely recovered. But early detection can help in both. And more importantly, it can also improve the quality of life of the particular individual who has been affected from cancer. If I'll give you certain examples, like bowel cancer, which is one of the common cancers, the cure rate, if it's detected early, is 97%, whereas if it is detected late, it falls to less than 40%. For liver cancer, the cure rate detected early is 70%, but detected late is less than 20%. For something like pancreatic cancer, the cure rate is 60% if it is detected early, but if it is detected late, it drops to 0%. That is, virtually it is not curable. So early detection does help in complete curing of the cancers and also improvement in the quality of life.
What are some suspicious signs that one should never ignore?
So, talking about the signs of cancers, the common signs are any lumps and bumps in our body, any lumps in our body, especially ones that are rapidly growing in size, is an important thing that you should take note of and get it examined immediately. Any sort of a bleeding from any orifice in your body, either it can be through vomiters or it can be through the stools, or it can be through your coughing or through sputum, any blood should be taken seriously and should be evaluated. Uh, Talking about gastrointestinal cancers, stomach cancers, usually the common signs are long form of gastritis. Usually gastritis is something that a lot of people get, but if it is persistent for a long period of time, for months together, it has to be taken seriously and evaluated. For bowel cancers, the commonest symptom is just change in your bowel habits. Like if you may be passing your stools once in a day, if that increases to 3 or 4 times in a day, take it seriously and get it evaluated. Or even if it decreases, where it decreases to once in 2 days, 3 days, take it seriously, get it evaluated. Uh, One more thing that I wanted to sort of pitch in here for liver cancers or pancreatic cancer is jaundice. Jaundice is something that we take very lightly. Jaundice in adults is a very important sign, and it can be a sign of cancer, and please get it evaluated.
How often should people go for screening?
By the term screening is actually getting yourself tested even before any symptoms appear. In gastrointestinal cancers, screening is advised mainly for bowel cancers. because that's where it has been found to be at most advantageous. For bowel cancers, all we need is a colonoscopy, which is just a tube passed into your gut, and that can be we can see the entire gut. This can be done once in 10 years, which is more than sufficient. So bowel cancers can be screened with just a colonoscopy once in 10 years. And if you have any risk factors of liver cancer, like any viral infections or liver damage leading on to cirrhosis, get yourself an ultrasound abdomen examination once in a year.
What does typical screening involve?
So, a typical screening involves a visit to the physician and talking to the physician. That is the most important step of the screening, where he can actually see you and elicit whatever the high risk symptoms or signs that you have. After that, it might involve few blood tests. Some of them are routine blood tests, some of them involve tumor markers. These are certain special blood tests which can detect presence of tumor quite early. It can also involve some urine tests. It does involve in most circumstances an ultrasound of the abdomen, which is some easy scan of the abdomen, and it also in most cases involves a scopy, that is an endoscopy or a colonoscopy, which is passing a tube to look at any cancers that have developed or not. In high risk individuals, sometimes we do a whole body MRI, but that is not usual.
Dr. Prasad Narayanan, Senior Consultant and Director, Medical Oncology, Cytecare Hospital. Doctor, is cancer treatment painful and debilitating?
That's an important question and one of the most common myths which is associated with cancer. So, the answer to this question is that with the present treatment facilities which are available, cancer treatment is no longer painful or debilitating. To put this in perspective, I can tell you about a scenario, a patient having an advanced head and neck cancer, whom otherwise a treatment would have been an extensive surgery which involves removing the voice box or the swallowing apparatus, is now treated in a facility like us with a multidisciplinary team. So we all sit together, we decide what is the best treatment approach for that patient at that particular point of time. We may give an alternative treatment in the beginning, like an immunotherapy or chemotherapy or radiation therapy, and then try to reduce the extent of surgery and make the treatment less debilitating with better outcomes.
How advanced is the technology available here?
So we are a state-of-the-art cancer center. We have all the technology which is available anywhere in the world, including the best of the technology for radiation, the latest advancement in surgical techniques, the laser therapies or the robotic surgeries. In terms of the medical oncology, we have all the medical facilities which are available. We have the state-of-the-art stem cell transplant facilities, stem cell research facilities, and we also are our institution supports clinical research. So patients have access to treatments which they cannot access in this country, but at an international level through clinical research which is happening here.
Is cancer surgery less invasive now with quicker recovery time?
So cancer surgery has become less invasive, and the era of more radical surgeries is now gone actually. So we are all in a situation where we want to use the least invasive technique to get the best outcome. To give an example, for the prostate cancer surgeries, they used to be debilitating surgeries before, but with the advancement of robotics, now we can do prostate cancer surgeries with very minimal side effects and excellent outcomes. That is just one perspective.
Have advances in technology and medication minimized the side effects?
So all the advancement in technology and medications are intended with two objectives. One is to improve outcomes, one is to decrease side effects. I would say that in cancer care, both have been achieved with excellent outcome actually.
What role is automation playing in cancer treatment?
This is the era of automation and cancer care is no exception. So we can just take the example of the simple thing that the government of India itself did when the COVID pandemic came. Teleconsults are now legal. That itself is the small acceptance of automation, and this is just the basic thing. There are so many improvement in automation which has actually helped medical care.
Is this facility drawing medical tourists?
So as I said, we are a state-of-the-art cancer center, and we attract patients from all over the world. we have had a large number of patients from many countries visiting us for advanced cancer treatments, and we have had excellent outcomes and good reviews from them.
Dr. Ajay Rao, Senior Consultant and Director, Radiation Oncology, Cytecare Hospital. Doctor, is cancer radiation treatment painful and debilitating?
Well, really not. There has been a myth around this. Yes, partly there are some side effects which are pertinent to radiation therapy, but this also depends on which site we radiate. For example, if it is a head and neck cancer, there can be some amount of mucositis which can be managed medically, and that is actually perceived that it is a bigger side effect. And with modern technology, we can reduce most of the side effects, and that is why it is actually not a debilitating thing, and we can manage this.
How advanced is the technology available here?
So we have the state of the art Versa HD, which is by a leading manufacturer called Elekta from Sweden. And this is one of the machines which has the highest capable technologies, starting from a simple three-dimensional conformal technique to as advanced as volume modulated arc therapy. And we also have incorporated CBCT, which will help for the image guidance. It is like a real-time verification of the treatment, and this helps in reducing the side effects and also treating the tumors more precisely.
Have advances in technology minimized the side effects?
Well, very much. This is the actually a soul of advanced technology in radiation oncology, and everything is around sparing the normal tissues and treating the tumors with more precision. So the more we treat the tumor, there is a chance that there is normal tissue also coming very close to each other, and we need to spare the normal tissues. So what advantage the technology gives us is that we can control the doses to the normal tissues and simultaneously give more doses to the tumor. In this way, we have a tumoricidal benefit and also preserving of the normal functions.
Doctor, is there any advance which has helped in reducing the treatment duration in cancer therapy?
Very much. History goes, radiation treatment was for around 1 to 1.5 months. But with the modern radiation techniques, we are able to give the same treatment in a lesser time and giving high dose per fraction. When you give high dose per fraction, you should also keep in mind about the normal tissues. So again, the normal tissue preservation is possible with using a higher technique. And with this, we are now able to finish the radiation in just 5 days or just 3 days in some of the conditions like cancer of the breast, prostate, and also in certain brain tumors. However, it is not for all the diseases, but yes, in some of the cancers which I mentioned, we can reduce the time, and traditionally we were giving it for a month and now it is reduced.